excited. We have our international keynote speaker that is coming on, and we are very excited about having Dr. Parsan with us. Dr. Parsan is actually ambassador retired, Dr. Neil Parsan. He is a diplomat, global health policy consultant, energy advisor, management consultant. He is also the co-founder and managing director of Parsan Cross, a Washington, D.C. based global strategic advisory group. He's the founder of Your247Doc, a telehealth company. Dr. Parsan has many years in the international business experience executing many projects globally with a focus in the Caribbean and Latin America. He was ambassador extraordinary and plenipotentiary to the United States of America, ambassador to Mexico, and permanent representative of Trinidad and Tobago to the Organization of American States. He held the cabinet position of Executive Secretary for Integral Development. He earned his undergraduate medical degree at the University of West Indies, where he graduated with distinction. He has a Master's of Business Administration, where he graduated as top student with distinction. He holds a registered financial consultant degree, a CACM from Harvard University School of Public Health, and a World Trade Professional degree from ITM Worldwide in Sweden. He was awarded the Honorary Doctorate for Education, Culture, and Humanitarian Work from the Americana University, registered with Cambridge University and the Congress of Mexico. His accolades go on, and we are honored and privileged to have our international keynote speaker, Dr. Neil Parsan. Thank you. Dr. Neil?
Thank you, everyone, and thanks for that very nice introduction. Can you hear me properly?
Yes, sir. We
awesome.
Can hear you.
And to all these speakers before me, I was listening for most of the morning. I had other things going on, but it was on in the background. I really appreciate the diversity. First of all, the geographic diversity of those who spoke, and the issues that were brought to the table. They were all encompassing. The language was correct, and a couple of speakers said a couple of things that really resonated with me. One is, it's nice to have policy. It's a totally different story executing that policy, and that message came out very strongly. I love the idea of the engagement of women and the role they have to play and continue to play. In fact, we are way better for it as a global community. And the last speaker, I think, was Kevin. Kevin, I think you and I met before. You brought up the point of legalize it. I totally agree, and the Jamaicans will understand that, but it's a point we often miss as Caribbean people. I'm from Trinidad and Tobago, as was introduced. I'm speaking to you, however, from Washington, D.C., and it's fascinating to me understanding the ability. I have been in D.C. for the last 10, 11 years in several capacities, but what is very clear to me is the focus of most of our governments, most of our space from North-South collaboration. And it was very clear to me on this call, the willingness for South collaboration. We have spoken about it, we have never really executed on it. And it's something that I think sessions like this should be welcoming to it. Let me congratulate the organizers of this event. I think the span of it is welcoming, and the focus of it. I heard a couple of buzzwords, inclusion, social inclusion, absolutely. Gender inclusion, it's critical. Financial inclusion, as for Martin, when he spoke about it, fintech, I'm in the fintech space as well. And it is where the world has to go, especially post-COVID. What I want to talk to you today about, a lot of what I probably wanted to say has been already captured in some form. But let's just look at this, what's the way forward? We heard a number of different scenarios, but we really have to take the world for what it is today. What COVID has done, you know, some authors argue it's the Great Reset. We heard a lot of COVID numbers being passed around today. What's the role of the private sector? We are all private sector individuals, but we are trying to structure an alliance of some sort. That was the topic of the last panel. I have worked with alliances before. In fact, I helped found one about 7-8 years ago with Johns Hopkins University and the WHO to deal with the issue of global surgery. It's a lot of moving parts to get it to where it should be, but I agree in principle with the pillars that were laid out in the last panel. And I also feel a big part of what we should be focusing on as well is that whole idea of South-South and what does Africa and what does the Western Hemisphere look like. As a background, ladies and gentlemen, I do a fair amount of public speaking every month. It's probably 3 to 4 times a month. And what is very frightening to me is I keep resetting my numbers as COVID has progressed. And where we are today, global trade is going to be down up to 30 to 32% compared to last year. It is going to continue to slump. We know the IMF, they have looked at the globe in terms of real GDP. Real GDP is projected to be about 3% globally, but Europe should be at about 7% growth. Latin America and the Caribbean, where a lot of us are from, is about 5.2% projection, with the US in and around 6%. What does that say? The polarity and the inequality will continue. The virus has already infected well over 115 million people with over 5 million dead. And it has disrupted many lives, but more importantly, livelihoods. We expect that over 100 million people will be plunged into extreme poverty. This year alone, 100 million people. We think that the number of the unemployed will hit staggering levels up to 150 million. And we already saw the OECD put out some information that they projected about 60% of small businesses will be closed. 60%. The numbers in the EU hovers around 52%. And during this pandemic, 70% of the world's businesses were closed in some form, or at least temporarily shut down. Why am I painting this picture of gloom and doom? I'm not. It is the reality, and we have a lot of work to do. We think, well, the global community thinks, through World Bank and other studies, the world would have lost about $9.2 trillion in the system as a result of COVID. What the world is trying to do now is to fix the problem by vaccinating. We have a serious, serious crisis in the Western Hemisphere and in the African continent. We don't have a problem of vaccine hesitancy. We have a problem of vaccine access. And no economy on the planet is an island unto itself. Unless we fix the global community, we will not be able to fix the global economy. So in other words, we have to treat each other with the level of courtesy and nationalism that all of us should expect if we are to fix this crisis. This is actually the largest public health initiative ever undertaken on the planet to vaccinate the world. And the focus is on speed and scale, really, as in low and middle income countries. But here's the thing, all of this is happening when a great chunk of the world is already unhealthy because of non-COVID related diseases. So it's a double whammy effect we are being faced. So far, we have vaccinated about 7.3% of the world, of about 7.8 billion people. And scientists think we need to probably hit about 75% of the global community to be vaccinated to solve this problem. Every day, we are hearing of these new variants. Right now, the last 2 days ago was Delta Plus variant. I would not be surprised if in a week or two, we have the Epsilon variant coming out. So all of you on this call and your colleagues and your families and so on, I would plead with you as a medical practitioner myself to get vaccinated. It'll help solve the problem. Where we are from, I'm from the Caribbean, and I'm hearing a number of Caribbean accents on the call. We have a particularly challenging period in the Caribbean. Aside from a lack of vaccines, we have countries like Turks and Caicos that probably hitting about 62%, excellent for them. But we have Haiti, where not one single shot was given. Not one person was vaccinated. So when we have that level of inequities, it is a crisis level for the region itself. We know a lot of us are depending on COVAX, the initiative, and they promised about 1.8 billion doses to about 92 countries. Hopefully that will be coming soon, and the US did indicate some support for the global community as far as vaccines are concerned. Just to tell you, just to touch on the Caribbean for a minute again, because I know there's interest on this call. So far, we have vaccinated about 1 million people in Latin America and the Caribbean. We expect to hit all that 1 million people, that's only about 3% of the region. But we expect within the next 3 to 4 months to get to an acceptable level of vaccinations. We are looking forward. Nowhere in Latin America and the Caribbean do we produce vaccines. We are seeing some hope coming out of Cuba. I know that's a sore spot for some. 2 of their vaccines were announced as to be ready. It needs to go through WHO approval. And the Dominican Republic, they're also looking to produce some locally, which is a good sign. In addition to that, if that's not enough problems to the region, we expect one of the heaviest hurricane seasons this year. 60% more activity compared to previous years, with about 20 named storms passing through, of which about 5 to become major Category 5 hurricanes. So the last thing we need is a hurricane season on top of a COVID season. But it's not all doom and gloom. The World Bank is helping to provide some resources, about $12 billion for us to try to deal with the issue. A lot of countries are on an active rollout campaign. We have the Caribbean and Latin America and the US. They have a great deal of experience in child immunization campaigns, so that should help, because we are looking forward to using the expertise in the immunization of children for the vaccines. And we also know that coming out of this, we have a huge opportunity ahead of us to create long-lasting solutions to these problems. Private sector has to play a role in many forms. I will touch on that in a minute. But I also feel we have to overcome this problem of what I call national rivalry. A lot of countries are looking to see where they are on these tables in terms of mortality and infection rates, etc. And they're blaming other countries. What that is doing, it is causing a competition in the race for equipment, for vaccinations, etc. And it's leading to geopolitical tensions. It's leading to an unnecessary level of protectionism. And, that vaccine nationalism is leading to the whole issue of vaccine inequity. And we are seeing some countries trying to play, exercise vaccine diplomacy, which is a good thing. But hopefully that will become a thing of the past, and we won't have that challenge to be dealing with. I also wanted to touch on the private sector for a minute, because that's where all of us are from. I believe going forward, the way forward for us must be governments leading from in the form that it must be an all of government approach, all of society approach, but government must lead in order to enable the private sector to lead. And I'm choosing my words here very carefully, because this exercise will not be done successfully without an active private sector. And I've been singing this song over public speeches for a while, saying that the private sector is armed with a lot of good, a lot of resources, a lot of business continuity management processes, a lot of solid private sector actors. The modus operandi has to be governments taking a very serious assessment of the true problems that they have during the COVID period and what's going to happen after, list out all the private sector actors and engage them. And that's essentially what we're hearing coming out of this discussion here this morning. The private sector owns and manages a great deal of resources, but those resources will be moot if the engagement of the private sector is not aligned to the government agenda in the way they want to handle COVID. And the little problem we have is private sector healthcare systems. And let me touch on that for a minute. We have some strong ones. In the US, we have some actually really good ones on the African continent. And unfortunately, the private sector healthcare systems run in parallel to and separate from the public healthcare system. And what that is causing, there's genuinely in many instances a lack of knowledge, a lack of know-how on how governments should actually be engaged in the private sector, especially when it comes to healthcare delivery. So they must be aligned. I think in terms of the vaccine rollout itself, many of you on this call, especially, and Loretta and your team, you guys are part of an alliance. And I really think you guys have a critical role to play, all of us really, in leveraging the membership of the alliances. And they have a role to play, especially now. Between now and the end of the year, listen, in a couple of days, we are exactly 6 months away from 2022. We have lost a year and a half, possibly 2 years of our lives to COVID. And in 2022, things must be normalized. Where I sit here in Washington, DC, I was out last night with my wife, and I was commenting, for the first time, I feel as though things are back to normal because, people are walking around eating in restaurants, etc. But a lot of us aren't so fortunate in other places where we live, simply because we don't have the vaccines and we don't have things are still under lockdown. But the point is, the private sector has to play a role in planning, in coordinating, in regulating, in helping to finance during the COVID period. That was done in the Philippines. In Nigeria, we saw the private sector getting very much engaged with logistics in cold chain, because many of these vaccines need to be stored at certain temperatures. In Nigeria, they got actively involved in cold chain management of the vaccines. We saw evidence where a big part of this campaign for advocacy, communications, demand generation was done by the private sector in Uganda. We saw actual delivery of vaccines, the private sector doing it in India, in Ghana. We have some good examples of how they can get involved. I also would make a strong suggestion that the private sector gets involved in strengthening human resource management and training, because we have to retool, repurpose, and retrain staff across industries. This is sector agnostic, across industries post-COVID. Look, Deloitte, I work very closely with Deloitte and Deloitte projects. Deloitte put out a notice to staff that they don't have to return to the future. They don't have to return to the workplace ever again if they choose not to. They can work digitally. So that involves a level of retraining. I've seen studies coming out of McKinsey and others where what will be the challenges in this new environment. I think there's a huge opportunity for the private sector to play, to pivot really into services in this new environment, transportation, ambulatory services for the healthcare industry, non-COVID related. I saw instances where, in certain countries, basic things like, this may sound a bit unnecessary, but burial services couldn't be handled by the state anymore. Burial services. Imagine we are living in a world now where we don't have enough facilities to bury the dead. Waste disposal, provision of PPEs, etc., is a great, great role for us to play going forward. I think I had mentioned the whole idea of private sector getting involved. One of the best ways we could do it, and forums like this could help, is innovative financing. There is no shortage of money out there. There's a shortage of good, mature projects and executable ideas. The problem is the innovation behind the financing mechanisms and the access to that finance has been quite challenging for many of us. So there is a role for that. We saw that MasterCard did it, TransferWire did it, TikTok did it by coming up with these aggregated grant financing arrangements. I think we have to come up with results-based financing. In other words, people are very skeptical to part with their dollars unless they have the KPIs that was mentioned in the last call. I think we have to overcome the challenges with governments working with the private sector when it comes to healthcare delivery. They have to build out the right lists. get the right private sector people licensed to actually deliver on the healthcare services, improve their know-how on how to engage, etc. A big part of the opportunity in the future would be how do we actually build resilient systems, healthcare systems going forward. There's a huge opportunity ahead for us to digitize not just records, but the processes of the economies going forward. That will be the new economy. Telework, teleschool, telecommute, that's a huge opportunity. And I know a couple of speakers who sort of alluding to that issue going forward. One thing the private sector, and I feel all of us on this course should be aware of, is as these lockdowns ease, there will be a dramatic shift in the responsibility for people's safety. Right now, because of government policy in many countries, the responsibility for the citizens' safety is on government. Lockdown, stay home, curfew, many of us are still under curfew. Trinidad is under curfew, Jamaica is under curfew. Many Latin American countries are. But as these lockdowns ease, there will be a shift in that responsibility to the private sector. Do you adhere to the protocols? Are you taking temperatures when people go in? That's something we need to be aware of. The trade bodies like ourselves, you know, the chambers of commerce, the international chambers, etc., they have a critical role to play in the form of working with governments to create these new rules and procedures post-COVID. Because we cannot be operating in the 21st century on 18th century infrastructure, 19th century policies, and 20th century training of staff. New rules will have to be written. The private sector and bodies like this will have to work with them directly. I think organizations like this must play an active role in educating its members. A lot of businesses, 70% of economies are MSMEs, micro, small, and medium-sized enterprises. They just don't understand the market dynamics anymore. It's changing every minute. So a big part of educating members through organizations like this will be critical. Bringing in foreign best practice via these corporate alliances I was hearing about absolutely should be way of the future. There's a huge opportunity ahead of us, ladies and gentlemen, not just in healthcare. I spent some time talking about healthcare, but in other sectors, for us to transform these sectors and drive recovery post-COVID. Agriculture, for example, there's a huge area for storage and logistics to improve those. Anybody in the agriculture business, I think Ms. Abatia from New York, who's now in India, was speaking about that issue. Storage and logistics is going to be one of the critical things. We heard of supply chains. Countries are literally locked down and they don't have food coming in. So that's a big area that could be improved. Supply chain relationships and strengthening is another area. I think there's a huge opportunity to transform the way working capital financing for MSMEs is made available. I know the World Bank and others are talking about it. There's a massive opportunity for us to think about digitalizing our transactions, e-commerce, putting things online. The world learned when COVID started about the need to be sovereign and have a level of manufacturing locally just to survive. We saw a rush on toilet paper, of all things. Toilet paper when COVID started. We saw critical sources of PPEs. All those things are opportunities now to fix and have domestic capacity to do it on your own. There's a huge opportunity for automation and workforce reskilling. The problem is, I speak of digital, I speak of technology, I speak of putting these things out there to futurize and bulletproof our economies. The problem is we still have unacceptably low rates of broadband infrastructure, of telephony, of poor broadband penetration itself. I think the future is going to be very much web-based adult training, and I think there's a huge opportunity for the private sector to think about that. Training and education, e-learning platforms. I could talk to you for days on telemedicine. I own a telehealth company here in the United States. I think digital healthcare is going to be by far the fastest growing industry in the world. And it is proving to be that way. In fact, it's projected to be a $2 trillion industry in the coming years. So there's a big opportunity for that. You know, looking at Africa for a minute, if I am to, I think there's a huge opportunity for us to look at South-South collaboration. When I say South-South, I mean, for those of us who are in Florida, in New York, in the Caribbean, or have roots in the Caribbean, there's a big opportunity to really strengthen our relationships with these countries. I've been to many of them. I've studied their healthcare systems. I've worked with governments there. I appreciate the fact that Africa is home to 6 of the fastest growing economies in terms of population growth, in terms of the rapidity of urbanization, and in terms of their acceptance for accelerated digital technology adoption. That's a huge opportunity in terms of increasing populations and the ability to digitize the economy. Africa as a continent is on the verge of the 4th industrial revolution, and it must not be left behind. I heard the reference made to the engagement of Chinese and so on and so on. That is, the sovereignty of each country is as good as its leadership and its ability to look after its people. So I think with that said, we have a good opportunity to really look to see how we can capitalize on the fact that 17% of the world's population is in Africa, and that is expected to grow to 28% of the world's population by the year 2030. Population growth. We know the 10 fastest growing economies in the world are six of them originate from Africa. Ghana, Ethiopia, Cote d'Ivoire, Senegal, Tanzania, to name a few. We know in the coming years that over 100 cities will be populated with over 1 million inhabitants by the year 2025, with about 58% of Africa's population living in cities by the year 2050. That's not far from now. So ability to digitize and introduce opportunities on the continent now is a win-win for the people, for us as entrepreneurs and businessmen, and for governments. There's a huge speed of the adoption of technology, as I indicated to you. And somebody mentioned fintech earlier on the platform. I'm actually working on a project there now that's really embedding fintech in a couple of countries. Happy to connect on the project. But it's one of the fastest growing continents in the world for growth of the wallet, the e-wallets, as we say. I don't want to spend much more time, Loretta, because I know we are probably burnt out in front of our screens all day, but I just want to leave you with a couple of thoughts. I want to leave you with the fact that I feel the world is at a position now where we have a golden opportunity to pivot and strengthen healthcare. If I'm to leave you with one thing, it must be health systems strengthening. We learned that money means nothing if we don't have our health, and look how many lives we lost. I think we have to rethink the way we deliver healthcare. We have to accelerate the implementation of digital health solutions. We have to improve access. We have to improve affordability. We have to bear in mind the world is living longer. People, believe it or not, on average, we are now living 4 years longer compared to 4 decades ago. And women are outliving men. I don't know what's your secret, ladies, but you are. And non-communicable diseases continue to plague us. Cardiovascular disease, cancers. 82% of the deaths in Latin America and the Caribbean, believe it or not, are from those two things, cancers and cardiovascular disease. We have a serious opportunity to help fix them if we digitalize healthcare. A lot of the healthcare systems globally are underfinanced. A lot more resources need to be put towards it. A lot of them are actually going through some sort of reform. We need to strengthen the reform process and fix the fact that 34% of people are plunged into poverty in Latin America and the Caribbean because of out-of-pocket expenses paying for medical bills. Why is it in today's world 34% of our population must be plunged into poverty because they got sick? So it's something we really, really have to deal with, and we have to fix the challenges, improve telephony, improve the success rate for ICT-based projects, improve the telecom infrastructure, upskill our workforce. Somebody mentioned competition. I totally agree with that. Incentivize good competition, train our workforce. So the list goes on and on. Let me just close by saying, rich countries' direct economic interest to ensure poorer nations are fully vaccinated must be our focus in the ultra short term. Widespread vaccinations in wealthier populations will help domestic business. We know that. We are seeing it in the United States. Business is up and running again, like restaurants, gyms, and other services. But there are many industries, such as the auto industry, the construction industry, the microchip industry, for example, retail, depend on outside countries for material, for parts, for supplies. And all these industries will continue to suffer if vaccines are not made available worldwide. It is going to affect it. And as I said, no economy is an island unto itself. Full global economic recovery will only come when every economy recovers from this pandemic. That's the only way for us to get back to where we should be. And these are matters of morality and humanity, especially during this global crisis and this very stubborn pandemic. I always argue, all of us are leaders in some form. We are all leaders. And our responsibility is to leave this world a better place than we met it. And that cannot be more true than where the world finds itself today. I wish all of you a wonderful rest of day, wonderful evening, wonderful morning to some of you. It was a pleasure. I'll be happy to take any questions, Loretta, if we have the time for it.
Yes. Are there any questions, comments, and concerns for Dr. Parsan?
I have
Very
a question.
Good. Okay, wonderful.
Loretta. Dr. Parsan, thank you so much, first of all, for your participation here. I'm wondering about what you project will be the most salient things that those of us in this community can do to help advance the future of our planet, which is essentially what we're dealing with when COVID is rampant.
Let me preface, that's a good question, and let me preface my response to you by saying to you, without scaring you, the COVID pandemic is a warm-up exercise for the biggest crisis the world is about to be faced with, and that's the climate crisis. The pandemic is a warm-up to what is about to happen. And if I'm to say anything to anyone, and I keep saying this, we have a planet to save, not just lives to save, but a planet to save. And the best thing all of us could start thinking about, and I do not use the word climate change anymore. I took it out of my vocabulary. The climate has changed. It's about climate smart action. And the message to you is, I think we will come out of this pandemic. I am of the view it's going to be endemic. It's here to stay. We have to learn to live with it. We'll have variants coming out. Let's make sure ultra short term get vaccinated. But the thinking now, we have to mainstream climate resilience in every single thing that we do. From your home, to your lights, to how you use energy, to how you green your roofs, to the type of diet that you eat, all the way up to governments mainstreaming it across government, all of society. Climate resilience is the one, that one idea we must be brutally focused on in time to come. Otherwise, I would love for my children and their children's children to enjoy what we have today.
Loretta, I have a question, not so much a question, but a note. Dr. Neil, thank you very much for participating in this event. I think many people are going to be reaching out when Loretta invited us to be in this event, we, my group, we very much proposed that there should be a follow-up session to this event. Because when you have the opportunity to bring people of this caliber together, you've got to have something else that comes out of this that turns into some concrete actions. We made the commitment to avail this community and also communities we're working with in the Middle East and Africa with our technology. Some of them are in the space of healthcare, education, trade, and so on and so forth, which we'll have some other conversations about. There is one thing that you said that I thought was pertinent that I do not particularly, no, that I think is pertinent. You made the statement that, of course, for the world economy to kick off again, everyone, we have to solve the COVID problem collectively. It's when every country comes out of it that the world economy will grow. But if we sit here with the assumption that that is the intent of every country, particularly the countries of the North, it is not true. I've had enough interaction. In 2019, I was at the World Economic Forum. I was at ITU. I did a speech for the Ministers of Finance at ITU. And the claim that I was making was simple, that we have to start accepting that natural interest will always trump the collective global well-being that we preach. And that the countries of the South have to start to play a game that says that we have to be competitive collaboratively and accept that our relationship with the North is always going to be one of competition because the North is not willing, however much we want to claim that, to be on par with the South. So therefore, what you were saying there to me makes incredible sense. My question to this audience as a whole is this. When we leave this conversation today and we go away, taking into consideration everything that has been said, how are we as a group going to work to do something about some of the issues that were raised? And how are we going to leverage our networks to bring more and more people into this conversation? In the preview to this session that was called, I made a statement about fulfilling the promise of a generation. And I think everybody is pretty much tired with these conversations that we have and these meetings and these good ideas that don't go anywhere. So here's my question to you. How do you see this audience collaborating to be able to start to make a dent in some of those issues? Not just take ideas away, but collaborating and becoming a source of a nucleus that can basically be expanded. How do you see that happening?
Very good question, and I like the idea of follow-up action. Otherwise this becomes a very expensive talk shop, right? I call it NATO, no action, talk only. The idea is we have to operationalize, action something at the end of this, right? Let me answer your question by giving you an example. How do we solve it? About 7-8 years ago, I was approached by Johns Hopkins University, an individual there, etc., etc. Long story short, we found that the world had a problem. And the problem was that about 80% of surgical diseases on the planet could be solved if we solve six things: cleft lip, cleft palate in children, obstructive pregnancies in women, fistulas in women, clubfoot, cataracts. If we solve those, we will take away about 80% of the world's surgical burden. So we started a conversation. You know what we ended up doing? We said, let's form a global alliance and bring everybody under the umbrella. Anybody who has anything to do with global surgery or surgery, delivery of surgery, bring them together under this umbrella. We ended up forming an organization called the Global Alliance for Surgery, Obstetrics, Trauma, and Anesthesia Care. It took years, but it had to start somewhere. We are starting somewhere by all of us talking. What we ended up doing, I calculated we needed about 25 organizations. We ended up at 92. We helped draft, we worked with a number of countries through this alliance of foundations, philanthropy, academia. So we had Harvard, Johns Hopkins, the Royal College of Surgeons in Ireland, COSEXA in Africa, some very large organizations worked together to help push a resolution called Resolution 6815 that was passed at the World Health Assembly in 2015 to recognize global surgery, these surgical diseases I identified to you, as a universal access to it, and it's a basic human right. So we started by changing the policy, the way we actually did it, by getting all these people to speak with one voice. And then we simply use these alliances. We meet all the time, week after week we meet and handle each of our alliance partners, help them execute projects on the ground. So, you know, cataracts in Nairobi, Clubfoot in Manila. How do we send resources, send trained staff, train the trainers, send, you know, help build surgical capacity, help the government actually create a national surgical plan so they have KPIs to follow to lower the case numbers. That is how you do it. I'm sorry it took so long to explain it, but it's, in my view, a good example of moving from meeting like this and actually getting work done. But it's a lot of hard work, a lot of diligent people behind it. It didn't take a lot of resources. The resources was more intellectual brain power to get the job done, and then create such a movement that it was noteworthy and powerful enough to make the difference.
Thank you so very much, Dr. Parsons. Thank you. Thank you so very much. We appreciate you. We thank you so very much for your time and your commitment. You are a very, very busy man, and we consider this an honor that you took time out of your busy schedule to be with us today. This conversation will be going forward, and what I'm excited about how you were able to bring it all together from all the conversations to make sure that there was a complete circle about the discourse and the work that needs to be done. Trust me, we will be getting back with you. I can honestly commit the people here because they're here because they are committed. And if you would help to advise us, and especially with the perspective of Chamber of Commerce's perspective, that we can get to people and get to the degree that we can get a control on this deadly disease so we can move forward. And the multiplicity of the problem is extensive, extremely extensive. We do understand that, but we want to thank you so very much for your time, sir, and for that comments. Your comments were profound. Thank you. Thank you. Everyone, let's clap for Dr.
Thank you very much.
Parson, there we are.
I left my my LinkedIn tag on the group chat, so please feel free and reach out. I'll be a number of things that were said over the course. I'm very interested in hearing a bit more the fintech. I would love to hear the role of, I know some of the females who presenters were talking about incentivizing some connections. I'll be more than happy to plug you into some noteworthy connections in that regard.
Absolutely.
And would be happy to chat further. Thank you so much, and thanks for your time.
Thank you. Thank you. Thank you very much. Thank you, Doctor.